Let me tell you just a little bit more about myself, but I want to ask y'all a question first. Do we have any veterans out here in the audience? Oh, woo! Thank you for your service. Disclaimer, I am not a veteran. Another disclaimer, I am here not representing the VA. So, the VA, as you probably know, is very bureaucratic. And so I had to agree that I'm not representing the VA here. But I am going to talk about the VA because that's my expertise. It was not my expertise 5.5 years ago. When I switched I decided in the last third of my career I wanted to go back to patient care. I had been doing nursing education, really wanted to spend the last years of my career taking care of patients. Not that I didn't like teaching, but it's just a different experience for those of you who may have a background in teaching and patient care. So I ironically had only ever practiced in my 30 years as a nurse in pediatrics. I did not have any experience whatsoever with adult patients. And so when I went back to the practice setting at the VA, I was like an infant nurse. And I had to learn from the ground up, not just veterans, but adults. Not just veterans and adults, but veterans, adults, chronic illness, geriatrics, because that's what I went into. So anyway, I'm going into this presentation, and I think wisely now, since there are not a lot of veterans out there, assuming that you do not know what I didn't know when I went into the VA. And so some of the information that I give you is going to be a little bit rudimentary, but it's because I'm assuming that, like me, you probably may not know a lot about veterans if you do not. Well, let me take that back. Even if you are a veteran, even if you do have a veteran in your family, that does not make the VA system or all the associated health care any easier to navigate. I will just say that. But yeah, absolutely. So anyway, so bear with me as I move through this presentation. That's why I thought this topic would be very important to y'all, is because I know that you probably need the same information I needed. So let me get rid of a couple pieces of my paper here. Okay, so there are a few things that I'm going to talk about today. The first thing I'm going to do is I'm going to talk about demographics and disparities. I'm going to tell you a little bit about who veterans are, what that population looks like. I'm going to tell you about some access and barriers that affect veterans' health care. I'm going to tell you about some resources and strategies you might be able to use with your veteran clients or patients through a couple of case studies. And as I am passionate about veterans, just like everyone is passionate about what they've spoken about today, I will tell you that I'm long-winded. And so I'm glad that Danielle is over there with her little signs, because I tend to talk too much. So anyway, and after that, I'll open the floor for some discussion. So let me tell you a little bit about the veteran demographics. Who are veterans and what do they look like? And some of these statistics may actually surprise you a little bit. So there are 18 million veterans in the United States alive today, roughly 7% of the U.S. population. Most veterans are white, 72%. Among veterans from other racial and ethnic groups, 13% are Black, 8% are Hispanic, and the remainder identify as more than one race: American Indian, Alaska Native, Native Hawaiian, or other Pacific Islander. The vast majority of veterans today are men. 89% are men, 11% are women. 6.1% identify as LGBTQ+. The median age, does anybody want to guess what the median age of veterans is in the United States? Did I hear a 60-something? 65. 65. So, speaking from someone who's not far from that number, an older crowd, right? An older crowd. And in fact, 49% of the veteran population is 65 or older. So in about 2018, the demographics changed a little bit. Starting in 2018, that is when the number or percentage of veterans who were Gulf War veterans surpassed Vietnam veterans. So my little story about veterans is this. Again, I'm a woman of a certain age, and in the South, we don't say that number, but I'm further along the spectrum than you might imagine. And when I was a young person, when I thought of a veteran, I thought of my grandfather, who was a World War II veteran. You know, in my mind, veterans looked like my grandfather. And that was a long time ago. Funny that we carry that with us throughout our lives, because I interact with veterans now, and in my mind, I'm still 8 years old, and I think, oh, here's this 75-year-old veteran. He must be World War II. Well, no, he's not. He's Vietnam. And so then I remember my childhood driving down on Sunday afternoons. We'd get out of church, we'd drive down Peachtree right here in Atlanta. And you know why we did that? Because my sister and I like to see the hippies, right? So that does give you a little bit closer idea about my age. Those are Vietnam veterans who are now in their 70s and even older. And so, and the Gulf War cohort is now getting older. So my preconceived notions of veterans are shaken up every single day. So don't know if that surprised any of you, but it shakes me every day. So what health conditions or disparities are veterans more likely to experience? So these are not necessarily terribly different than what your clients out in the regular population experience. However, veterans are at higher risk here. And I will also just say that veterans who are from minority groups or underrepresented groups suffer them at even a higher rate than non-minority veterans. So anyway, you probably could read this litany off yourself based on just what you see on the news, but veterans are more likely than the general population to have substance use disorder, depression, anxiety, PTSD, very complex comorbidities, which is what I work with pretty much every day, congestive heart failure, COPD, diabetes, hypertension, much higher rate of suicide, a higher rate of traumatic brain injury, and especially the closed brain injuries, more likely to have amputations and nerve damage. And more we're learning about the toxic exposures, and I'm going to talk about that a little bit later. You've probably seen the PACT Act referenced in the news multiple times. So we're going to talk about that in terms of toxic exposures. They're more likely to have insomnia, and they're more likely to have hearing loss. About 3.9 million veterans, or about 20%, receive some sort of VA disability compensation. And in 2021, the Department of Veterans Affairs spent $121 billion on compensation and pensions for veterans. So lots of money involved. So now I'm going to tell you just a little bit about the VA if you don't know it already. Some of you have had some experience either as patients or advocates or as a family member. The VA is a very huge and complicated system. There are about 1,300 healthcare facilities, 172 of these now. It's changed since I made this slide. 172 medical centers, and then well over 1,000 outpatient clinics. We call them CBOCs in the VA. That stands for Community-Based Outpatient Clinic. And so about 62% of all separated veterans have used VA healthcare in the last 20 years. So 62% sounds like a lot, but there are probably a lot of veterans out there who are eligible who are not actually getting services. And sometimes they don't even really know how. And so part of what I provide at the end of this presentation is a really comprehensive list of resources that are available. I can't possibly tell you all about them in this short period of time, but I was able to provide a pretty comprehensive list of sites you can visit and places you can go to learn how to help veterans access their eligibility and other resources. So here's some points about the VA that are wonderful. There are some wonderful things about the VA, and I'm about to tell you some of these. For one thing, veterans have access to very highly specialized care. When you think about any kind of care a veteran might need, cardiac care, pulmonary care, sleep medicine, neurology, psychology, psychiatry, I could name a million, orthopedics. They can get it all in one place, and that is an enormous advantage. And you know that because you deal with patients all the time and know how fragmented systems can be. So if you've got a veteran who's getting all their care through the VA, good for you, because that makes things a lot easier. Doesn't necessarily make things better for the veteran, but it does make things easier, because not only can that veteran move from location to location, they can move all the way across the country, and their records and care from the VA are going to be accessible to their care providers. However, if any of you do have veterans who are clients, you know that rarely do they get all their care at the VA. Now, sometimes they do, and that's easy, but a lot of times they get their care through some other providers. And again, we'll talk about that a little bit more in just a second. The VA also gives veterans access to certain services that they would not even get out in the community or through another health plan. For example, transportation, housing assistance, vocational rehab, other social support services, drug and alcohol rehab, domiciliary services for homeless veterans. There are all kinds of things that a traditional health plan would not provide that the VA does. And so that's one other really great thing about the VA. There's a reduced financial burden. So if a veteran is getting all their care through the VA, it's a much simpler thing to understand than traditional health insurance. It's a little bit more like a single payer system in terms of simplicity. However, as I said before, that gets a little bit complicated because sometimes veterans don't just get their care through the VA, they get some other services from other places. Research and innovation. So lots of research going on at the VA, cutting edge research. Some of the top priorities at the VA right now are mental health, substance use abuse, and suicide. Suicide prevention is like the number one research priority of the VA. And most times the VA is partnering with some pretty impressive academic institutions so that it's well-rounded research and it's well-informed research. So in Atlanta, for example, the VA partners with Emory University, which, as you know, has a great medical school, lots of research going on there, all kinds of benefits of those partnerships. There are wonderful peer support programs for veterans through the VA. So if a veteran has a traumatic brain injury, or a veteran has PTSD or depression or a history of suicide or substance abuse, there are all kinds of peer support groups and networks that are available in the VA, associated with the VA, that really can hook up veterans with others who really, truly do understand their experience. And for any of you who know veterans, there is a real camaraderie in being a part of that social group, and sometimes for veterans, that's one of the greatest losses they feel when they leave the service, is they have had this incredible bonding experience with other people, and they leave it and often feel quite bereft. And so being part of the VA can afford them some connection with peers who are like them. And so these are all positives of the VA, right? But don't think that I don't have a few other things to just say, because transparency is important, right? And we all know that every healthcare system has its good aspects and its bad. And so now I'm going to talk about some of the barriers that you may experience in navigating healthcare for your veteran clients or advocating for your veteran clients. You would think that with all these facilities that I just mentioned, and all these resources, that system would be able to really maximize service delivery and do it efficiently, right? Well, it doesn't. It can be extremely bureaucratic. That's extremely frustrating to veterans, extremely frustrating to their family members. And I'm going to talk about some of these barriers, and then we're going to get into some tools or some strategies you can use as a I'll keep wanting to say provider because that's what I use every day, as an advocate, to help your veterans navigate this system a little bit better. So here are some of the barriers that are facing veterans as participants in the VA healthcare system. The first is a workforce shortage. But you know what? Guess what? Y'all know this already. That's not unique to the VA, right? By 2026, there's expected to be a critical shortage of over 3 million healthcare workers. Doctors, nurses, respiratory therapists, social workers. You name a profession that's associated with healthcare, there's a shortage. And all the available systems out there are fighting and competing to hire people. And we can't produce them fast enough. So this is a problem at the VA, but it's a problem everywhere else too. And honestly, I think sometimes veterans perceive it. If they're only getting their care at the VA, they often perceive that this lack of staffing is a problem with the VA, right? But we all know that it's not. We've all experienced this, right? So bureaucracy, we've already mentioned bureaucracy. It is a huge government bureaucracy that struggles to keep up with the backlog of disability and eligibility claims. We get these wonderful resources like the Mission Act, which we'll talk about in a little bit, Mission Act and the PACT Act, which actually give veterans more resources, more benefits, eligibility for more services. But y'all know what happens if there are not enough people to process those claims. It doesn't mean that veterans are actually getting access to those things. So that's part of the bureaucracy, that there's a bureaucracy, but then there's staffing shortages, which impact the ability to make these systems work more efficiently. There are outdated systems and facilities. So anyone who has gone to a VA facility, I don't know where you've gone, but the one in Atlanta is really old. The median age of VA hospitals is 58 years old. That is not state of the art. The facilities look old, they feel old, and that does not feel welcoming to veterans or anybody else. Leaks that recur, parking lots that have to be rebuilt, all of these are things that can really challenge a person's experience at a VA facility. Politics and legislation. Not going to get into that too much, but fortunately, most politicians do agree that veterans are a high priority and should be prioritized. The problem then comes in deciding how best to serve veterans, and there's not a lot of agreement on that. And you know, people don't trust politicians, right? So when veterans are told that they're going to get a new service they don't necessarily believe that because their experience has not been that they get what they're promised. That's just sort of a long history. And, you know, one example of the politics and legislation that affects veteran health or veterans in general is you all remember don't ask, don't tell, right? So for like 18 years, the policy was encoded discrimination, right? Like, okay, well, you can be something a little different, but we just don't want to know about it. So that was repealed back in 2018, I think, or 2011, but people still don't trust people who were in the military during that time still carry a really bad taste in their mouth. And as you know, in some more recent administrations, that has reared its head again in sort of different ways. And so rather than talk about that a lot, I'm just going to move on. So those are organizational barriers. Here are some logistical barriers. And any of you who work with veterans or have a veteran in your family may have experienced this. It really sort of depends on your VA facility too, because you cannot measure all VA facilities the same. There are some that are stellar and there are some that are not so stellar. And so your experience in your location may be very different. So let me tell you about a few of these logistical barriers. Appointment scheduling. It's very hard to schedule an appointment at the VA, especially for veterans who are technology challenged. So what do we know? I'm including myself. What do we know about people 65 and older? They are not computer literate all the time. Now, I promise you, I've got some 90-plus-year-olds who are way better with their technology than I am. So you can't use that as a broad brush, but it's generally true that people who didn't grow up with technology are not as savvy about technology. So appointment scheduling can be a challenge. Drive time can be a huge challenge. So in Atlanta, maybe you live 25 miles from the VA. That doesn't seem like it should take you more than 30 minutes, but depending on the traffic, it's going to take you 2 hours. And I'm sure the same is true in LA and some of the other huge metropolitan areas. And if you don't live in a huge metropolitan area, then your barrier really is distance. It's how do you really get from 2 hours away to the main VA hospital. Transportation. A lot of veterans don't drive, can't drive, don't have a family member who can drive them, and don't have access to any sort of public transportation because, again, we live in a culture in which public transportation is not prioritized, and so veterans in most places can't use it to get somewhere. And Uber and Lyft, as we all know, in coming from the airport here in New Orleans to this venue, that's not a cheap ride, right? Right. So my experience has been that with all of these frustrations and logistical barriers, I've learned that persistence is key and being a squeaky wheel is key. I have been a nurse long enough that I don't care who I work for, right? I don't care what the VA needs. What I care about is what the veterans need. And it does not bother me one bit to complain or advocate or be a super squeaky wheel. I'm not worried about getting fired. I'm worried about whether or not the veteran's getting care or not. But y'all know that anyway because that's what you do every day in every situation. So anyway, my first piece of advice to y'all is to be a squeaky wheel with the VA. They're gonna make it happen faster if they want you to be quiet. And they will want you to be quiet. So there's some personal social barriers as well. I'm not going to spend a lot of time on these. Y'all know this. There's a personal skepticism or lack of trust. There's fear of discrimination, military attitudes and socialization. There's this stoicism that is part of the military way, and you're taught to suck it up and live with it and bear the pain. And so that is something that we encounter a lot with veterans, is not wanting to really admit that they need help. And again, the technology deficit that comes up all the time. So the most important way that you can kind of help bridge some of these barriers in particular is to encourage veterans to use the resources that are available to them. There are a ton of resources available, and I'm going to share some of those with you. They can communicate directly with their providers if they use secure messaging through My Healthy Vet platform. It's a really easy way for them to send their message to their doctor. And unlike in some other systems at the VA, the providers are held accountable for how long it takes them to answer an instant message. Email goes out every day, the unresolved instant messages, so or secure messages. So that's a good tool for them to use. And for you to sometimes navigates some of the more frustrating situations that will just drive them absolutely out of their minds with anger and frustration. So sometimes it just takes another person who's willing to do the difficult work. So I'm going to shorten my case study here to, I was going to tell you about Larry and Dion. Who would y'all rather hear about, Larry or Dion? Larry, Dion. I'll go through them. I'll go through Larry, and then we'll see how far we get. Okay. Okay. So Larry is a 76-year-old Vietnam veteran, 100% service-connected disability, which means that all the problems that he has are in some way, shape, or form associated with his military service. And so he's got the best of all worlds because he can get all of his care through the VA. He has stage 3 kidney disease, congestive heart failure, an implanted pacemaker. He's on blood thinner. He had an adenoma of the prostate, overactive bladder, bilateral osteoarthritis of the knees, spinal stenosis with chronic unremitting pain. He's on Tylenol with codeine. He has neuralgia, complete loss of his teeth due to caries, hypertension, PTSD, irritable bowel syndrome, with a history of gastric hemorrhage and skin cancer. So this is a complicated guy, right? Well, he has frequent falls. Does that surprise anybody? And every time he has a fall, because he's on a blood thinner, what does he have to do? He has to go to the ER. He's got PTSD. Does he like me telling him he needs to go to the ER? He surely does not. He has a severe cardiopulmonary disease that limits his walking. He's only able to walk about a half a block before he gets short of breath and has to sit down. Plus, he's got osteoarthritis of both knees, so he's got the knee pain and the back pain as well. Do you think he's a good candidate for surgery? No, he really is not. But he and his spouse has cancer, so she is limited in what she can do for him. So some of the resources that are available to Larry through the VA are the Caregiver Assistance Program, which will reimburse his wife for the care that she gives to him on a day-to-day basis at home. In addition, he can get home health aid twice a week for personal assistance. He gets full dental coverage, which is like gold in the VA. Not many veterans qualify for 100% dental coverage. He has eligibility for assistive devices such as the stair lift, home modifications, power wheelchair, vehicle lift, the Veterans Transportation Service, specialty care from podiatry, GI, vascular surgery, cardiology, pulmonology, hem-oncology, teledermatology, physical and occupational therapy, and pain management. Because he lives 43 miles from the VA, and that is well over a 60-minute commute, he can get community care for a lot of these specialty services if he chooses, which means that he can go to a provider who's close to him. This is important for this veteran. I'm not going to go into it anymore, but just let's say that every time he gets to tries to go to the main VA, he has some sort of trouble. So I'm going to skip Dion. She is equally as interesting as Larry. The point being, I just wanted y'all to be aware of some of the resources that are available. So some of the things I was going to tell you about as far as non-VA resources are Social Security, Department of Community Affairs, housing vouchers, the Fisher House, the VFW, and any community care referral for any specialty care, surgeries, etc., that they do not have access to at the VA. So I think my time is pretty much up, but I did want to talk to you about 2 pieces of legislation that have really significantly impacted veteran care in the past 10 years. So the first is the Mission Act. The Mission Act was passed in 2018 to guarantee that veterans who needed care outside the VA would be able to access it. So they decide with their provider whether or not community care would be a better choice than VA care. And the things that qualify them for community care are drive time based on geomapping. How long is it going to take them to get to the service at the VA? Wait time, is it going to be 28 or more days before they can get an appointment? But a lot of things, there's one other qualifier that a lot of people don't know about, and that is best medical interest. And a lot of VA providers don't know about best medical interest. So if a primary care provider knows that Mr. Smith went to an outside ER and went to see a cardiologist as a result of that, that primary care provider can write a consult for an outside provider based on best medical interest. They just have to be able to justify it. And that's something that a lot of providers don't know. So I would encourage you that as you're looking at some of these resources, you look at the qualifiers for community care, because sometimes the VA doesn't know the rules very well. But if you do, you can keep pushing somebody in the Office of Community Care to make that happen. The other more recent act that you may encounter is the PACT Act. It is the new law that was passed in 2022 that expands VA health care and benefits for veterans exposed to burn pits, Agent Orange, and other toxic substances. So this really adds a whole lot of potential reimbursement and health care coverage to veterans' benefits. And finally, the other thing I really wanted to mention to y'all as a really important resource for veterans I've referenced a couple of times, and that is the VA Office of Connected Care. There is a whole website that tells you what kinds of services veterans can access remotely, equipment that they can receive free from the VA to help them access remote care, free iPads, all kinds of things that they can use so that they can have video visits, chat with their doctors, just be more connected without having to go into any kind of facility at all. So again, in my presentation, there are live links to all of these resources. And honestly, your best bet is going to be, if you've got a veteran in your life or on your caseload, please set aside a day to look at some of these resources I've provided, because they will, I don't want to use Pandora's box. That's bad, right? It's like a treasure box of stuff that's available and readily easy to find. There's just so much of it. You have to spend some time with it, understanding it, and looking at it and reading it and mastering it. So I have several more slides, but y'all will be able to access these as you need to. I've got some resources and strategies from the VA, some external advocacy resources, and just a whole lot of links to service organizations that can help with housing, transportation, other things. So that's all I had to say on veterans. I thank you all. If you are a veteran, if you love a veteran, or if you work with a veteran, thank you very much. They are quite the population, and I've got to say, they're my favorite group of patients I've ever worked with in my entire life. So anyway, any questions?